Creatine monohydrate has been the most popular supplement for gym rats since the early 1990s, and for good reason. In hundreds of studies, it has been shown to be both beneficial and safe in dosages of 3 to 5 grams per day. Why then is it still taboo for some people to use to this day? In this video, I'm going to be addressing 12 common questions about the supplement. If you don't find the answer you're looking for, drop it down in the comments and let's talk about it. I'm Avi Spies, Biokineticist in Windhoek, Namibia. Does creatine lead to water retention? Yes and no. If you do the 7-day loading phase of using 20 to 25 grams every single day, then you will definitely get some water retention. However, once you go down to the maintenance phase of 3 to 5 grams a day, after that the water retention should disappear. This is not a given though, so it kind of depends on you as a person, whether you do hold water or not. So creatine shouldn't cause water retention, but if you do the loading phase, odds are it will. And then for some people, even at maintenance phase, you can also get the water retention. So the data says creatine probably won't cause water retention, but you could be the unlucky person that it does hit. So just keep an eye on that. Here we come to a very popular question, one that every soccer mom on earth seems to believe for some reason. Is creatine an anabolic steroid? Categorically, no, it is not. The study looked at the mechanism of action and the legality of creatine versus anabolic steroids. Creatine is legal, anabolic steroids are not unless you have a testosterone replacement therapy prescription from your doctor, and also the mechanism is completely different. Testosterone or other anabolics work on the androgen receptor. Creatine simply causes the ATP stores in the cells to regenerate faster. So you recover from exercise a little bit faster by this pathway. The androgen receptor is a whole different rabbit hole that I'm not going to get into in this video. What I take issue with this specific study is it said that the gains you can get from creatine and anabolic steroids are comparable. This is utter nonsense. There is no universe where creatine is remotely comparable to anabolic steroids. Creatine can give you up to an 8% boost in recovery. Anabolic steroids can more than double it. So there is absolutely no comparison between the two. Creatine is not a steroid, but do not expect the effects of steroids to hit you the same. Does creatine cause kidney damage? This is a very common question. I'm sure you've also heard it in your life. I grew up hearing it every single time that creatine is going to melt your kidneys. You've got to be really careful. And it is the most dangerous thing that you can use. I always wanted to know, is this really true? And now we have an answer. Where did this traction come from? Where did this false belief of creatine causing kidney damage come from? Because it doesn't actually cause kidney damage. In 1998, there was a case study done on one person who already had focal glomerular sclerosis. This is a pre-existing kidney disease that this patient had for 8 years. He was also on immunosuppressants for 5 years. Then he started taking creatine supplementation, and after 7 weeks, the researchers decided that because of an increase in creatinine, which is what creatine is metabolized to in the muscles anyway, that this person's kidneys were deteriorating faster. This was a false assumption by the researchers because correlation does not equal causation in this case specifically. After this, letters were written to Lancet and this theory gained traction. And if it was true, millions and millions of people who've been using creatine since the early 90s would have also had severe kidney problems based on this data. So if you do have pre-existing kidney conditions, probably consult your doctor before you start using creatine. Otherwise, you are completely in the clear. Creatine has no negative effects on kidney function. Does creatine cause baldness? No, it doesn't. The question comes from a study that was done many, many years ago by a Mr. van der Merwe on a group of rugby players. Now, if you've seen a group of rugby players, you can probably count on your one hand the amount of them that does have a full head of hair. You get exceptions like Eben Etzebeth and Faf de Klerk, but the rest of them have the whole chrome dome situation going on, especially here in Namibia and South Africa. So, where does this come from? Creatine has no effect on testosterone. This has been proven in 12 studies, but the researchers in that specific study found an increased levels of dihydrotestosterone, which does cause baldness. A disclaimer, if baldness runs in your family, like your granddad and your dad, you will still get bald whether you use creatine or not. This is the unfortunate reality of genetics, but it will certainly not be the fault of the creatine. Does creatine lead to dehydration or muscle cramping? This comes from a recommendation from the American College of Sports Medicine in the early 2000s based on very, very limited data that people who are on a diet or who exercise in really hot environments like 40 degrees or over should not supplement with creatine. Not limit the supplementation use, like avoid it completely. The reason being given was that creatine is going to mess with your electrolyte balance, with creatine bringing water into the cell and the sweat taking it out, and this would cause cramps. Now, athletes tended to believe that supplementing with creatine would give them cramps. Then, when they were actually given creatine, they experienced less cramps with creatine than without it. This is because the creatine brings the water in and the sweat takes the water out. So even if you exercise in a hot environment or you're in a calorie deficit, the very thing that the American College of Sports Medicine was scared of happening tended to be the opposite. So, in short, creatine might actually prevent cramps rather than cause them. So, the next question is a question I get a lot from the parents of my younger patients. Is creatine safe for children and teenagers? Based on the limited amount of evidence we have so far, it does appear so. In athletic populations, more evidence needs to be gathered and more variables need to be taken into account to say with complete certainty that it is safe. In pediatric patients, the blood work has shown no negative effects of creatine, and the two metrics that have shown improvement are muscle mass and grip strength, which is directly associated with living longer. So, in conclusion, we need more evidence to say with complete certainty that it is safe for children and adolescents, but it does appear to be thus far. On to my least favorite question about creatine. Can creatine make you fat? I get so freaking tired of this question. The only thing that can make you fat is by eating more calories than you are burning. The second law of thermodynamics, calories in, calories out. If you eat more than you burn, you get fat. If you eat less than you burn, you lose weight. It is as simple and as complicated as that. There are many factors that influence this. I'm not going to get into that. It still goes down to calories in, calories out. Creatine does not contain calories. Thus, it cannot make you fat. If you buy a creatine supplement that has a significant amount of sugar with it to shuttle the creatine into your cells, that contains calories which can make you fat. But creatine itself cannot, for hopefully the last time, make you fat. Is a loading phase required when you use creatine? Let's first dissect what the purpose of creatine loading is and then discuss the merits of it. Loading with creatine involves using a lot of it at the same time, like 20 to 25 grams every single day for the first seven days, and then you will get full cellular saturation of creatine after those 7 days. This is the entire purpose of it. You want to get your cells as full of creatine as possible in the shortest duration possible. If you use the regular maintenance dose of 5 grams a day, after 28 days, you will get the exact same cellular saturation level as with the loading phase. Now, whether it's worth it for you depends on, can you cope with the side effects, which includes severe gastrointestinal distress. Almost every single patient of mine experienced severe disturbances, not just regular disturbances. So if that's worth it for you, then you can cope with it. The other thing is water retention. You will for sure get more water retention like this, but that should also go away once you go down to the maintenance dose. And then you will run out of creatine faster, so it will cost a little bit more just for that initial phase. If this is worth it for you, then you're more than welcome to do the loading phase. In my opinion, I would not do the loading phase for myself. I think it's a waste. And after 4 weeks, you get all the benefits anyway. Is creatine beneficial for older adults? Yes, it is. Since 2020, a lot of people have been looking into the cognitive benefits of creatine. Dr. Mike Israetel from Renaissance Periodization recently did an excellent video on this. I'll link it in the description if you want to go check it out. Very, very good on the cognitive side of it specifically. What I'm going to discuss is if creatine has additional benefits apart from the usual benefits it has for adults, like increased muscle mass and increased functionality. For the older people, yes, it does, but when paired with a structured exercise program. Better when a professional does it for you. If you just do it on your own and you don't know what you're doing, your chances of getting hurt are significantly more when you're an older person. So there aren't specific studies that show conclusively there are massive benefits of just using creatine. It has all been paired with exercise, and this is where most of the benefits come from. On the cognitive side, that's a different topic that I'm not discussing here, but from a physicality standpoint, creatine with exercise will definitely have benefits for older people. Is creatine only useful for fast, explosive power movements, as it has been reported? In fact, it is not. There are many other modalities which creatine can help you with. The first, it can help you maintain optimal glycogen levels if you participate in a sport that lasts for longer than 30 minutes at a time, like running a half marathon or riding a stage of the Tour de France, which lasts significantly longer than that. Then, second, it may reduce muscle damage and enhance recovery from intense exercise, regardless of the modality of that exercise. So it's not just for powerlifters or Olympic weightlifters. If you use creatine, your recovery from any form of exercise will be enhanced. The degree to which it is enhanced kind of depends on your response, but you will for sure see an improvement. Third, there is evidence that creatine leads to fewer musculoskeletal injuries, accelerated recovery time from those injuries, and less muscle atrophy following immobilization. So if you had a shoulder surgery like myself and you are immobilized, you will lose less muscle while using creatine for the duration of your immobilization, and your recovery time will be enhanced as a result of this. Fourth, as we discussed a little bit earlier, creatine helps to hyperhydrate the cells, so you will lose less water while exercising in hot environments, thereby getting less cramps. And the most important thing is there is a neuroprotective effect from creatine to such a degree that the International Society of Sport Nutrition recommended that athletes who participate in contact sports who have a chance to get a spinal cord or a brain injury supplement with creatine because of those neuroprotective effects. So it reduces the severity of a spinal cord injury, cerebral ischemia, concussion, or traumatic brain injury. People, this is massive. If you have seen what a traumatic brain injury does to someone, if you've worked with people with a stroke, if you've seen the effects people have from concussion and how long it takes you to recover, it is horrible to see. It's very difficult to work with. And if there's anything that can make these people recover faster, and something as simple and cheap and accessible as creatine, it is an absolute game changer, and I'm all for it. And I hope all rugby players, American football players, any type of contact sport, I hope you guys see this and I hope you take it seriously. Is creatine only beneficial for males? No. But gram for gram, it will be more beneficial for males than for females, because females have higher levels of creatine concentration inside their muscle cells already. Further, the implications of hormone-related changes in creatine kinetics has been largely overlooked in performance-based studies, so there's a lot more information that we can get on that subject. Specifically, creatine supplementation may be of particular importance during menses, pregnancy, postpartum, perimenopause, and postmenopause. Maternal creatine supplementation during pregnancy in preclinical animal studies have demonstrated a protective effect against fetal death. What you must understand with this is this was done in animals, and it has been shown to be very, very beneficial for the fetus pre and post birth. This was not done on humans. So to assume a one-on-one translation from the animal study to the human study is very irresponsible and also probably incorrect. The chances of it being beneficial for you and your unborn baby as a pregnant lady is high. However, please consult with your medical professional. I'm not 100% sure that it will be beneficial. I'm confident that it will be, but I cannot say with absolute scientific backed certainty that it will be. But let's look at some of the science-based effects. Reduced creatine levels in late pregnancy have also been associated with low fetal growth. There's additional data that the metabolic demand from the placenta during gestation further lowers the creatine pool of the mother, which may be associated with low birth weight and even preterm birth, which we all know is very, very dangerous. Creatine supplementation during pregnancy has been shown to enhance neuronal cell uptake of creatine and support mitochondrial integrity in animal offspring. Mitochondria are the powerhouses of the cell. If these things absorb creatine more effectively, you will be a much healthier person and everything in your body will function more optimally, thereby reducing brain injury induced by intrapartum asphyxia. That means at some point during their pregnancy, these animals, the unborn fetuses, experienced too little oxygen and their brains were damaged less in the mothers who used creatine than those who didn't. Although there are no human studies, again, evaluating the safety of creatine during pregnancy, the chances are it could be, but please bear in mind, we do not have any human data on this yet. Further, females have been reported to have lower levels of creatine in the frontal lobe of the brain. Increasing creatine concentrations in the brain as a result of supplementation, particularly in females, may support the reported benefits of reducing the symptoms of depression. So, creatine can actually help you with depression, not just if you're a female, for any person. I've heard a few psychologists discuss this as a possible treatment effect, not to replace selective serotonin reuptake inhibitors as of yet. However, as I will discuss a little bit further on, in people resistant to SSRIs, it can be a possible replacement. So let's have a look at what the science says further. Depression is about 2 times higher among females throughout their reproductive years and accelerates around pubertal hormonal changes. Altered brain bioenergetics and mitochondrial dysfunction have been linked with depression, particularly as it relates to creatine kinase, ATP, and inorganic phosphate. All of these are raised by supplementing with creatine to a significant degree. The increase in cerebral phosphocreatine from 10 grams of creatine supplementation, which is about double the normal dose, was reported to be inversely related to symptoms of depression in adolescent females resistant to selective serotonin reuptake inhibitors. It appears that creatine supplementation may be effective for supporting creatine kinetics, mood, and pregnancy and fetal outcomes. What this all boils down to is if you are a depressed person, then using creatine might make you feel a bit better and might actually be a useful treatment modality along with whatever else your doctor decides to treat you with. Creatine supplementation appears to be a viable option for postmenopausal females to improve muscle quality and performance. We discussed it is useful for older adults when paired with a resistance training program, and the exact same thing is said here as well. So, in summary, there are multifactorial therapeutic benefits of using creatine if you are a female. I think it's completely worth it. If you are a female, give it a try and see how it works for you. To the final question of this video, are other forms of creatine superior to creatine monohydrate, and has creatine been developed in a stable form in a beverage? Which would be quite nice, wouldn't it? So, since the 1990s, creatine monohydrate has been the most extensively studied form of creatine, and it has been shown to be 99.9% either absorbed or excreted through normal digestion. Other forms have been all hype. It is not backed up by the science at all. And I remember very vividly, in 2019, I watched a video by Jeff Cavalier from Athlean-X about how he described how his creatine hydrochloride is the next best thing, is the best thing since American cheese. And this is simply the form of creatine that you have to use. It only costs 6 times as much as normal creatine monohydrate. And he illustrated it by taking the monohydrate, mixing it with water, and saying that this little crystalline layer that forms in the bottom of the glass, that will do the same thing in your intestines and it will not be absorbed, and that over time it will clog up your digestion, which the science clearly says it doesn't, and this was all just for marketing. And I still feel stupid to this day that I believe that story. So don't believe the hype. Creatine monohydrate is where it's at. Please rather just use the monohydrate. Anything else is overhyped nonsense and will simply not give you the same effect as the monohydrate. Now, what you got to make sure of, though, is where are you getting your creatine from? Because German creatine monohydrate is 99.9% pure, and that has been the source of most of the creatine used in the clinical studies. Other sources, like from China, for example, some have been contaminated with heavy metals, so your chances of getting some form of contaminant in is less than insignificant. Lastly, creatine is not stable in a solution. Unfortunately, all efforts to have a physiologically significant dose of creatine in a solution or in a beverage has not been successful. So it doesn't work. It just degrades to creatinine, and you will get nothing from it. Basically, you will get no benefits, and you will only pay for something that is a expensive energy drink in the end. So use the powder, make sure it's from Germany, and don't buy Jeff Cavalier's creatine hydrochloride. Thank you for watching to the end of the video. Hopefully you learned something new about creatine. If you're on the fence about taking it, hopefully I managed to convince you. If you're still unsure or you have any questions, please drop them down in the comment section. Hit like and subscribe, and I'll see you in the next one.